Hi guys, here I am doing kitchen posts from Lee Ankrum. So there's my book, The Atlas of Human Anatomy, and here's the page that we're turning to. And I love this page because I always love to talk about the respiratory diaphragm. So this is us looking up from underneath the diaphragm. We're looking up from the bottom. Here's the really cool part. It's showing us all sorts of groovy things. So notice that the respiratory diaphragm is a big muscle. And I actually teach. When I teach, I always say that if I could only work on one muscle in the whole body, the respiratory diaphragm would be that muscle that I would release. Now you want to know why. Well, like, why would that be? Well, it's because the respiratory diaphragm is in relationship to so many different systems, okay? So many different systems. So let's identify a few things here that you can see. One is, look at that the aorta from the heart comes through the back part right in front of your spine here, right in front of your vertebrae. Your aorta comes through a hole here in the respiratory diaphragm. Just in front of it here is the hole that the esophagus goes through in order to go to the stomach, which lives on just underneath the left part and down into the abdomen of the diaphragm. Crazily enough, this big hole over here on the right is for your Vena Cava, which is the big return vein that goes from the bottom part of the body and returns blood up to the heart. So we have blood, esophagus. But what we also have here is, obviously the stomach lives here, but so does the spleen, as I posted the other day, lives over here on the left. What also lives over here is your liver is very big, nestled underneath the respiratory diaphragm. But also what is sitting right here on the back wall of the diaphragm on either side is your kidney. So your kidney is over here on either side. So we have a lot of organs that are in relationship to this. Coming through the hole of your esophagus is also coming your vagus nerve that's coming down to innervate or to come to your organs and to relax your organs and give them the right kind of tone in order to have you move your digestion through. Also over here on this side, it's actually on both sides, but it's only showing on one, is obviously this is your psoas. This is your quadratus lumborum, but this is your psoas. What this doesn't show is how actually the fascia from the diaphragm merges into the fascia of the psoas, which is running down. This is your hip flexor. Notice that your hip flexor is in relationship to your respiratory diaphragm. The other thing that's happening is that those kidneys are living on the hip flexor. So I don't like to look at structures just as, oh, this is an independent structure. I like to see them all as their relationships between each other and also the big fascial connections between them. The one last thing that I'll say, besides saying how important it is that the diaphragm has the right tone for all of these organs. Of course, I've talked about all the organs on the bottom half, not on the top side, haven't I? Because you have lungs and heart in relationship to the respiratory diaphragm on the other side of it. So, kind of interesting. But one thing we don't tend to think about is that our bodies are pressurized, and the respiratory diaphragm is one part of the pressure system. So we want our diaphragm relaxed and sitting where it should so that the pressures in our, either on the top side of the thoracic cavity don't get too tight because the diaphragm tends to go up in tightness, or the abdominal cavity doesn't lose the correct pressure like it gets less pressure. So notice how it's in relationship to so many things, to nerves, to blood, to organs, to fascia, and now to pressure. So, you know, if you're a massage therapist or a body worker watching this, my suggestion is the next time you have a client in, just kind of nicely sort of push on the diaphragm and see if it has some give, if it feels like it's got good tone. Remember, it's my muscle that I'm going to work before I'm going to work anything else if I only get one. Have a great day, you guys. Talk to you soon.